हम लोग वेस्ट बंगाल कुछ बिहार से आए हैं, तो ये लास्ट 10 ईयर से इस प्रॉब्लम से एंडोमेट्रियोसिस से भुगत रही थी। हर महीने इनको पीरियड्स में बहुत ज्यादा तकलीफ होता था, बहुत ज्यादा प्रॉब्लम होता था। इससे पहले 2018 में हमने एंडोमेट्रियोसिस का एक लीकेज करवाया था, ड्रेनेज ऑपरेशन करवाया था बैंगलोर में। फिर लॉकडाउन आ गया, हम आ नहीं पाए, तब भी बहुत प्रॉब्लम हो रहा था। तो लास्ट कुछ महीने पहले हमने नेट पे सर्च किया बेंगलोर में, फोर्टिस में मनीषा सिंह मैम के बारे में। तो बहुत अच्छा रिव्यू दिखा, बहुत और फीमेल बहुत रिलीफ मिला उनको मैम के वजह से। तो हमने मैम से आके मिला, मैम ने कुछ टेस्ट दिए, तो फिर मैम ने हम लोग को कॉन्फ्रेंस दिया और वादा किया उसका पेन जो भी है अंदर बहुत मैस है और ये वन ऑफ द मेजर ऑपरेशन होने वाला है, क्योंकि उनका एंडोमेट्रियोसिस बहुत बढ़ चुका था। तो मैम ने ये ऑपरेशन किया लास्ट ट्यूसडे को, 3 तारीख को जुलाई में। मैम ने बहुत अच्छा सर्जरी किया, अभी ठीक हो रही है धीरे धीरे और होगा तो हम 15-20 दिन में वापस जाएंगे। थैंक यू मैम फॉर सेविंग।
Hello, I'm Dr. Manisha Singh, Senior Consultant Gynaecologist and Subspecialist in Reproductive Medicine and Surgery at the Fortis Hospital, Bangalore. Mrs. Poddar came to see me from Cooch Behar for a second opinion. She is a known case of endometriosis with long-standing severe symptoms of pain, dysmenorrhea, and of course they had also been trying for a baby. She had undergone a previous laparoscopy for endometriosis in 2018. And subsequently, because of COVID, her follow-up had been inadequate with the clinical team. This time round, she presented with severe abdominal pain. And when we scanned her, we found a large mass arising from her abdomen with a very bulky adenomyotic uterus. And we were sure that this is recurrence of severe endometriosis. In view of her ultrasound scan findings, as well as those of the MRI, where the bowel also seemed to be involved, we decided to embark on a laparotomy to relieve her of her symptoms. At laparotomy, we found a completely frozen abdomen and pelvis, where one could not delineate between the uterus, the adnexal structures, the bladder, sigmoid, and small bowel. After extensive dissection and adhesiolysis, we found a large mass which was a hematosalpinx full of pus, and we drained almost 400 cc of pus from this hematosalpinx. Subsequently, we performed a hysterectomy with bilateral salpingoophorectomy. In the right ovary as well, there were endometriomas, some of them full of pus. Same with the left. And when we dissected the bowel, we found 5 endometriotic nodules along the rectosigmoid, in view of which a resection anastomosis was performed and a diversion ileostomy was also performed. Mo has withstood the procedure very well, and I sincerely hope that in the coming few weeks she will make a complete recovery and she will be alleviated of her symptoms of endometriosis. As everyone knows, endometriosis is a very debilitating disease, secondary to the impact of estrogen on the uterus as well as the ovaries, where ectopic endometrium grows in aberrant sites like the ovaries, behind the uterus, and in distant places. It can cause very, very painful periods, painful passing of stools, painful passage of urine, and chronic abdominal pain, infertility, and what have you. So if you have any of these symptoms, you must seek assistance from the right specialist who deal with endometriosis day in and day out to help us alleviate you of your problems and symptoms. Thank you.